To offer to you this morning our April forum entitled Elder Care. As you know, our mission is to eliminate or eliminating barriers to getting and keeping jobs. And so you will find information from our panelists this morning that will certainly assist us to achieve that mission statement. We have 4 panelists with us this morning, and they're in order as they are on the flyer that you receive, and we will proceed accordingly. I'm going to introduce all 4 of them at one time. They are aware that each one has 10 minutes to share information with you. After each has spoken, it will be followed by about 10 to 15 minutes of Q&A. I would like to remind you to complete your evaluation forms, and we'll tell you a little bit about the form that is coming next. Chrissy, I'll probably ask you if you will share a little bit about the form that is coming next. So without more ado, we have to my extreme left, I believe it's Jackie O'Connor, who is the Assistant Director of the Area Agency on Aging of Western Michigan. She will be doing an overview of what a caregiver is and resources available. Number 2 person is Cheryl Snow, and Cheryl is a registered nurse like I am. She's a wife, mother, and family caregiver for her mother. She's employed. She will be speaking on employed caregiver, balancing work, family, and caregiving. The 3rd person is Joyce Fawn, and Joyce Fawn is the Regional Director for Alzheimer's Association for Greater Michigan Chapter, and she will be speaking on caring for elders who are diagnosed with Alzheimer's. And last but certainly not least is Maggie McPhee, and she is the Director of Information Services with the Employers Association, TEA. She will be speaking on FMLA, flex schedules, and employer accommodation options. And they will just follow one right after another. With that, I would like to turn it over to the panelists and ask Jackie if she would proceed, please. Thank you.
Good morning, everyone.
Morning.
Last night, probably were at the grocery store, maybe picking up some groceries. You picked up a quart of milk for your neighbor while you're there, just to help her out. This past weekend was a great warm weekend. Perhaps you're out doing some spring cleaning for your uncle's backyard, needed some help there. Or maybe last month you took mom to the doctor because she can't drive and she needs some help getting there. If you do any of those type of activities, you're a caregiver. And the caregiving is starting. Probably most of people in this room are caregivers and you may not know it. Typically, when you're caring for a child, it's 18 years, typically. And as the years go on, the caregiving decreases. Typically, when you're caring for an older adult, it's more than 18 years now because of lifespan. And the amount of activities you're involved in caregiving increases as the years go on. 80% of the caregiving is done by family members. Only 20% of caregiving is done by professional caregivers. The typical caregiver is a woman in her 40s who has 2 kids, works outside the home, and is caring for an elderly relative. So she has lots of responsibilities, and maybe you know someone in that scenario, or you may become someone in that scenario. Last year, the services that are funded through the Michigan Senior Services Program were helped out over 19,000 caregivers. And these are services that my agency is involved in. We monitor services that go for elder adults and their caregivers. And I just wanted to give you a few statistics about those 19,000 caregivers that were served last year. 74% were female. 37% were daughters or daughter-in-laws. 30% were spouses that were caregivers. 68% of those caregivers have been caring for a year, and that's according to their definition of caregiving. Those definitions, those examples I gave in the beginning, are all part of caregiving. You may think you're doing a favor for a friend or neighbor or relative, but it's really caregiving. 42% of the caregivers that we helped last year have been caregiving for more than 3 years already. A third of the caregivers had to travel more than an hour to give care, so they don't necessarily live next door to their relative or are not a spouse of the relative. A third of the caregivers were taking care of someone with a cognitive impairment, and we'll hear about that later in the panel. 37% of the caregivers were employed, whether they were part-time employment or full-time employment. And 75% of the caregivers were actually providing hands-on care, meaning maybe helping them get in and out of a chair, go up a stairway, helping them take a bath, something where they actually had to be physically involved with the caregiving, not just running to the store or taking them to a doctor's appointment. I think we all need to realize we're not superheroes. We can't do everything, so we ourselves, our employees, need to know what's available out in the community to help if they're in a caregiving situation, and to give them a break with their hectic daily activities. I'm sure you have employees who are in this scenario. They want to keep on working. They may need to keep on working. And if they're a good employee, you want them to keep working for you. So what can you do to help them out? And I think today we'll be able to share some of those things with you. I know someone's going to talk about the Family Medical Leave Act, but myself as an employer and someone who works with elderly and caregivers, I have some other things that you should be aware of and hopefully share with your employees. One, I'm sure what we'll hear about is the fact that you recognize that some of your employees are going through this scenario of taking care of a relative or a family member or neighbor. You need to offer them some flexibility in their work in order that they may take care of these responsibilities. Probably the main thing that I want to talk about are the services that are available that they should know about and will help them in taking care of those responsibilities and still be able to work. And I have a packet that I handed out to people, and there's a lot of material in here. But probably the key thing that I want to talk about is on a yellow multi-page packet, and it lists the services that are available in Kent County. Now, many of these services are also available in other counties, but I'm going to specifically talk about what's available in Kent. The first thing would be transportation. It's nice to have a relative go with you to the doctor's office, but it's not always necessary if it's a routine doctor appointment or a medical test. There are agencies you can call that can take an individual to a medical appointment. And they have individual cars, they have agency vans, they have tickets for Go Bus. There's a variety of things, ways to get the person to a medical appointment. In this document are a list of all the different services, some that I'll talk about, a little description of them, and the agencies who actually provide the service, and a phone number that you can call to ask them about getting the service. Another array of services are bringing services into the home. If you have an employee who's off to work, concerned about their family member eating, there's meals that can be brought into the home, whether it's every day of the week or just a couple days a week. We have homemaker services, where someone can come into the home every other week and do some light housekeeping. That way the caregiver doesn't have to worry about doing that not only in their own home, but in their relative's home. Personal care aides that can come into the home. And probably the thing that they do most is help giving baths. It's hard to get someone in and out of a bathtub if their mobility is limited, and if they're being cared for by a spouse who is not that strong, there's potential problems there. So a personal care aide may be able to come into the home and help with that duty. Also, some care recipients aren't thrilled about a child giving them a bath, so they're more open to a outside person doing that. Personal emergency response systems. Little buttons that you push when you fall and you can't get up. You know, we've probably all seen that commercial. They are not just buttons, they're wristbands, they're necklaces, but there's always a connection to a live person if they need help. If the employee is off working, that they know that their relative can contact someone if something happens. We also have volunteer programs that would help out. A friendly visitor program where volunteers go into the home, visit with someone, chit-chat a little bit, and so the person who is at home while their caregiver is off to work has some contact with the outside world. Same thing by telephone. We have telephone reassurance. Someone who can call every day, ask how you're doing. Again, bringing some contact with the outside world. It's just a nice reassurance that the care recipient has a contact with someone else besides their caregiver. We also have programs such as adult day services, which Cheryl will be talking about. This is an environment that where it's a monitored, secure environment. Take care of activities, meals, medication, and it's typically with someone with a cognitive impairment. We also have support groups, education programs. In your packet, there are information about the Caregiver Resource Network and their website. I would suggest people go there and look at what is available in the community. You're interested in keeping your workforce focused on the job. You need to make them aware of what's available out there. The material I provided should help. If there are any employer who has like a lunch program presentation, the Area Agency on Aging would gladly come and talk to employees about what's available.
As was mentioned, my name is Cheryl Snow. I am married. I have 2 college-age daughters still living at home. And my mother came to live with us 3 years ago. She has pretty significant dementia, and it has gotten much worse in the 3 years that she's been living with us. I am a nurse, and that was a huge advantage for me in being able to bring her into my home and take care of her because I was already doing this as part of my job. And so I guess it was easy in a way. I understood what dementia is and felt pretty able to take care of her. I guess I would consider myself to be the primary caregiver, but it is, in our case, it's totally a family effort. I don't think I could do it if I didn't have such a helpful family. And of course, my daughters will soon be moving on, and then my husband and I will have to figure out if we can continue to do this. As was mentioned, as the population ages, it's more and more common for people to be caring for elderly in their home, and probably every employer has someone working for them who is in this situation or will be. It has been a huge challenge for me to work outside the home, to the point that we've wondered if I really should continue to do so or if maybe I should do it a lot less. Almost every day we literally have a family meeting to figure out the next day how we are all going to do what we need to do, how all 5 of us are going to be where we need to be with the few cars that we have, and who can drop mom off and who can pick her up. And it's not easy. It's been quite a challenge, and it's something that we continue to work on. I have to be very careful that I don't put too much on my daughters because for one thing, they're not really natural caregivers as far as taking care of people who are incontinent, and that's fine. I understand that. That is not everybody's cup of tea. And so I don't want to put them in a position where we hate Grandma being here because we have to do all this. So I've actually had to back off quite a bit and relieve them of a lot of that duty because I could see that they weren't really enjoying it, and it wasn't really their primary responsibility. I made the decision to have my mother here, and so I felt I have to make sure I do most of the care and try to do all those not so easy things to take care of. Of course, every home situation is different, so that's something all of us who are in this position have to work out. And I think what's hard for me is I would think from an employer's point of view, the employee needs to be at work. They need to be there, and they need to be on time, and they need to be focused on their job, and that is true. And of course, the employee who's in this position is hoping that they can always be at work and be on time and do what they need to do. And having some flexibility and understanding, of course, is very, very helpful. And I've had that on my job, and it's meant a lot to me. I think it's not that different from mothers who have small children and work outside the home. When the child is sick, someone has to be there. Or you go to work and you get this phone call from the babysitter, can you come and get your child? They have a high fever and they can't stay here. Or, you have doctor appointments and other things that can only be done during the day when you're supposed to be working. And so these same kinds of situations are going to come up when you're trying to take care of an elderly person, especially if they have dementia, and there's a lot of things to consider, and they can't be left alone, and someone has to be there, and you have all these things to work out. Now, I have not had to miss a single day of work so far, but part of that is because of my wonderful husband, and he is always able to pitch in, and if something really bad were to come up, a lot of times he could probably stay home or work something out with his job if I can't. But again, I think a lot of it depends on your job. Now, I'm a nurse, and when I'm scheduled to be on duty, I'm the only nurse on duty, and I kind of need to be there. And the night nurse really doesn't want to hear from me at 7 in the morning. I don't think I can make it in. That would not really be a good thing. So again, that's like a personal issue for me. Is this the right job? Can I keep doing this? So far, it's been okay, but I realize at some point it might not be. Like I said, anything that an employer can do to give some of that flexibility, of course, is wonderful and much appreciated. When I found out about this today, I went to my boss, and their schedule was not out yet, and I said, do you think I can be off that Friday? And she said, sure, no problem, you can be off that Friday. So I think each situation has to be looked at differently. Another thing, you run into sometimes is if it appears you're showing favoritism to this employee, they can come in late and leave during the middle of the day, and I can't, and there's all these things to think about, and I see that on my job too. Because of my job, I can't come in late, and I can't really leave early, and I can't leave in the middle of the day. So, I think some jobs just perhaps are not as conducive to trying to care for elderly when you have these emergencies and things come up. Other jobs, it probably works out quite nicely. I think one of the biggest things an employer maybe can do to help the employees is to make sure they are aware of the things that are available to them. I could not take care of my home and kind of be a mother. My children are older, so they don't need me as a mother so much, and care for my mother and have a halfway clean house and work outside. I could not possibly do these things if I did not have all the help that I have in the community. My mom goes to the side-by-side daycare program. She's there right now. Most of the days that I work as a nurse, that's where she is. When I have a day off, I usually keep her home with me. Sometimes one of my daughters can be home with her. This program is wonderful. And it's very good for my mom to go. It's not only that I have a place to take her so I can work, but she is so much better when she goes. When she's at home, she just sleeps, she sits, I'm not very entertaining. I don't seem to have good ideas to keep her awake and stimulated, and she goes there, and there's people and activity and music and things going on, and it's been a very good thing for her, and she talks about the things that happen there. We also have a place, we take her for respite care. If we want to go away for a weekend or a week, or maybe we have a really busy time going on at home and it would just be very hard to arrange everything, I have a place I take her, and I think she has stayed there up to 9 days when we went away in January, and that's been a lifesaver too. I also have somebody come into my home about once a week right now and stay with her. Actually, on Sunday while we go to church, we were taking her, and that became very difficult to take her. So we're trying this as a solution, have someone come in the home, stay with her while we go. Thing is, I'm shocked at how resistant people are to accepting help. I work with people even who have parents with dementia, and, I'm not having anyone come in my home. I don't have time to be taking her to a daycare. I thought, well, okay, but you're going to be burned out, your family's going to be unhappy, and these things are just so helpful. And I got over a lot of that, I don't need help, I can do it. No, I need help. And again, I look at my situation frequently. Should I keep working? Maybe I should work less, maybe a different job. Maybe don't make my daughters do any of this. I'm always reevaluating. But in the meantime, these sources and the resources in the community are just so valuable. So if you can encourage any of your workers to think about that, for some it might be the difference on whether they can work or not. And if they really want to keep working outside the home, they really may need to think about utilizing that.
Good morning. Well, when I told my son that I had a meeting at 7:30, he started laughing because I'm not the best morning person, but we'll just work with that, okay? I'm Joy from the Alzheimer's Association, and I think that your topic here is very timely because currently there's more money spent, or more time lost and money spent on workers that need to take care of their parents or some other elder person in their life than there is being lost on child care right now, which I think is a pretty profound statement because for years people lost time from work taking care of their kids, and now they're losing time from work taking care of their parents or some other older person in their life. And like what was mentioned here, a lot of that has to do with cognitive decline. And one of the things that people always ask me when I do trainings or when I do public speaking is what's the difference between Alzheimer's disease and dementia? And that may sound like a real silly question, but actually about 80% of the people that I talk to really don't know. There's a lot of words that are thrown around in the media these days, and there's really not a lot of definition with those words. And the difference is Alzheimer's disease is a type of dementia. If you think of dementia as an umbrella term, it's a group of symptoms such as memory loss and cognitive changes, physical, that impacts their physical day-to-day activity, like being able to take care of themselves, bathe themselves, those kinds of things, as the disease progresses. There are over 80 different kinds of things that cause dementia. For example, if someone has Parkinson's disease, as that disease progresses, that may result in some cognitive decline, some dementia. If a person has some health issues, that may result or show some signs and symptoms of dementia. If someone has a head injury, if someone has nutritional issues or dehydration and those kinds of things. So some of those things can be have some positive outcomes. Some of those things are going to have a gradual decline, and Alzheimer's disease is one of those things. It's an actual disease process that affects the brain that causes a little by little the brain cells to die off, which results in dementia, cognitive decline. Alzheimer's disease is the number one cause of dementia. The second cause is dementia with Lewy bodies, and the third is something called vascular dementia or multi-infarct dementia. All of those things, though, result in similar types of symptoms where the person eventually loses their ability to remember things, to do daily activities, and manage their own life. Where the Alzheimer's Association comes into this is we do a lot of, I call ourselves kind of information brokers in addition to service brokers, because we provide a whole scope of services. The Alzheimer's disease, in addition to providing services, we also are second in terms of providing finances for research to find a cure for Alzheimer's disease. The national government, or the NIH, is the second, or is the first one that sponsors that type of research. But what that might mean to you locally is what services we're able to provide and what kind of information. Probably our most utilized service is called our helpline. And you heard some testimonies here by folks that are very involved in caregiving. And one of the things about caregiving is not only do people, like Jackie said, not always realize that they're caregivers, they don't always understand the impact that that has on their life, because most people don't have that many opportunities to care for their parents as their needs change. So it's not like we're all experts out there and we're all professional caregivers that know what to expect. So one of the things that we get is we get calls on a regular basis to our helpline, and that helpline is available 24/7. And that means at 3 o'clock in the morning on Christmas morning, if something's going on and you have a question about why mom or dad or aunt or uncle or spouse is acting this way, or there's some behavior changes and you're not quite sure what to do with it, or they're not sleeping, etc., you can call that helpline and you'll get a warm body on the other end of that line. And we have a lot of information, a lot of resources. The other thing that we provide locally, we work collectively with a lot of the organizations in the community that offer services for caregivers and with older adults. And so that means that we work collectively in helping to develop and to provide services that will work effectively. We work with the day programs, we work with Area Agency on Aging. We also provide some educational services. I put some materials out in front of you, and if you look at the purple one on the inside cover in the back, and I'm not going to go down all of these because I don't have enough time. And I've been known to not have problems with saying things. I've been known to have problems shutting up. So anyway, if you look at the inside of the purple one, it talks about a lot of the services that we provide. And you'll see that the helpline is the number one up there. The support groups we provide locally, the Alzheimer's Association, the regional area that we cover is a 6-county area. The Alzheimer's Association is across all of the country, but for the purposes here, locally we have about 22 to 25 support groups all over the 6-county area. And you can get that information by just calling the number, and we can pass that on to you. We also provide information and consultation to families and to spouses, significant others, anybody with a question. We can do that. We have a telephone support line for caregivers as well, called our Care Partner in Touch. Locally, we do not provide respite services. We do have one of our regions that provides that, but we work collectively with the local services. We do a lot of educational training. Some of the information you might want to grab up here is one of our more successful series is called our 3-part series. And we offer that about 6 or 8 times during the year, and sometimes more often than that. But we work with local professionals, and the 3-part series, it runs for 3 consecutive weeks, and we hold that at different parts around the different counties. The first session, we work with a local physician that specializes in geriatric and cognitive changes. And so the first 2 hours really focuses on medical aspects of dementia and cognitive changes. The second week, we work with a local attorney, and they'll come in and talk about financial planning, all different aspects of what type of things to expect if you're caring for someone or you're responsible for someone as they age. It doesn't necessarily have to be a dementia-related issue, but certainly that's what often draws folks to us because that's who we are. The third part of that, or the third week of that series, talks a little bit about more local resources and cognitive changes in dementia in general in terms of behavior changes, how to address those behaviors, how to work with that, and again, some resources that might be available. We've had a tremendous response from that program, and frequently asked to have it more often than we're able to provide it, just because of we don't have enough time to do it that many times. But there's some information here that when the next series is being offered. The current series that's being offered next week is the last week, and that's in Byron Center, and that information's there. The other service that we provide that's just getting started up right now is called our early stage dementia. One of the things that's happening, and I don't know if you've seen it too much, but there's a less common type of Alzheimer's disease. It's called early onset. And that means that it affects folks that are generally like in their 40s and 50s and maybe even early 60s, that those folks are a little bit more vulnerable because they wind up having a lot of times families that they're still responsible as part of their families. They may have children, spouses, and that kind of thing. So the dynamics of their families a little bit different. Our early stage dementia, though, our support group, that focuses on folks that are in the very early stages of the dementia. And what we do, it's a 7-week program, and we do it collectively with Pine Rest Hospital. So we bring the spouses or the caregivers in and the person with dementia and work with them collectively as well as separately to identify and address some of the changes that they experience as they go through that dementia process. We have a lot of educational materials both online and in our office here in Grand Rapids that you're welcome to come and look at and check out. Our Safe Return program, we really encourage families to look at that. If you have a loved one that is at risk of wandering away, which is a very common part associated with Alzheimer's disease, is that need to have some activity and walk, and folks don't always know how to get back home. The Safe Return program is a national database service. What you do is the person signed up. That way, if they wear an identification bracelet or some other type of identification. So if the person does leave home, isn't able to find their way back, whoever finds that person, there's information immediately available. All they have to do is to look at that bracelet. There's a number on there. They call that number, and they can immediately be contacted. The primary caregiver. So it expedites the return and the finding of that person about 6-fold. So it's a real safe kind of thing to make sure that your family member has. Advocacy and research, I talked a little bit about that. Basically, if you have a concern that either some of your employees are they're starting to spend more and more time away because often appointments are scheduled during work times if you're a caregiver, like it's been talked about here already. You're certainly welcome to have them call us, and we can connect you with the other resources and the services in the community that might be of assistance to them. And I think I should probably stop, because if I get going more, I'll be just going more.
Thank you. Good morning. As said earlier, my name is Maggie McPhee. I'm from the Employers Association here in Grand Rapids. We are a not-for-profit association of member companies. Currently, we have about 560 member companies that from Grand Rapids in about a 60-mile radius. And we provide services all related to human resources for those member companies, which is why I was invited to be here today. One of the things that I do is I answer hotline calls, and I also do HR roundtables, and I do surveys for wages and salaries and policies and benefits. All of that ties together with what we're talking about this morning, because I'm talking to the HR people. I'm talking about the issues that they have to deal with. I'm talking about the attendance. I'm talking about the policy administration, all of those kinds of things. So when I was asked to be here today, I went out and I looked at the some survey data, and I talked to a lot of the member companies that I deal with in the roundtables and asked them what's going on with elder care. Is it an issue? Is it not? What are you seeing out there in the workplace? And nationally, there are some services that are being provided by employers that are actually on the rise, shall we say, regarding elder care. The Society for Human Resources Management is a national HR association, and they do an annual policy and benefits survey. And one of the biggest changes that I saw in their policy survey was for elder care referral services. Over the last 5 years, it's gone from 19% up to 26%, so that's a bigger one with the referrals, that employers are offering that, which I know is really, it corresponds completely with what's going on the other end with the child care. I mean, more employers are doing just a referral service as opposed to providing on-site care. And also, whether or not elder care leave is being extended beyond the family medical leave, which I'll talk about in just a second. About 14% of employers, and there were about 370 companies that responded to this survey, about 14% are saying that they are having to extend or opting to extend the leave, a leave of absence beyond the federally mandated family medical leave. Emergency elder care, that's about the same over the last 5 years, that about 5% of employers are seeing that they're needing to do some emergency elder care, which that would be probably what I would expect with that. And also whether they subsidize the cost of elder care on a national level. Now, I haven't heard about that on the local level, but on the national level, they're doing some subsidization there of elder care. And that's very minimally. About 3% of employers might be doing that. And I would imagine that they're probably the larger employers. Locally, what I did was I went and I asked I got about 28 companies to help me out with a few questions regarding elder care. And I asked them, I said, of all the Family Medical Leave Act leaves that you are granting, what % of them are for elder care? Minimal. Not very many at all. I would say probably, about 29% maybe are affected by, of their granted leaves for family medical leave are for elder care reasons. And the other issue with family medical leave, that is for employers only with 50 or more employees within a 75-mile radius, so it doesn't affect everybody. Not everybody's eligible to offer family medical leave. And then within the companies, you have to also figure out whether or not the employee is eligible for family medical leave. Now, the only way an employee could take family medical leave to care for their parent or an elderly parent would be if that parent had a serious health condition. And trust me, I don't have time to go into that this morning. But they would have to have it certified by a doctor or by a medical practitioner, shall we say, that it was indeed a serious medical condition or serious health condition that needed to have that person care for them. And the other thing is, I think what's going on with the family medical leave and why they may not be seeing it used as much for elder care is because it's spread out a little bit more through family members. I mean, with child care, they're your child. You have to, you're the only one really besides your husband probably that could, or spouse that could take care of the child. But with elder care, it gets spread over all the siblings, generally speaking. So that's a little bit easier. But one of the biggest things I see is probably, as was mentioned earlier, is the flexibility that employers need to give and are going to probably be looking at in the years to come with the increase of the baby boomers and everything. I was also asking if they've seen a difference in their attendance. Have they seen any increase in attendance issues regarding elder care? And not too much, but maybe about 20% of the respondents said that they were seeing a little bit of an increase, and they're not complaining about it. They didn't say it was anything drastic or anything nothing that they would not have expected in the first place. Most of them, probably about over 50%, are saying that it's having the elder care issue is having little impact at this point. However, let me qualify that by saying all of them practically were saying that they know it's coming. They realize it's an issue, they know it's out there on the horizon, and that they're going to have to deal with it. Again, as far as the Family Medical Leave Act goes with elder care issues, it does have to be for a serious medical condition or serious health condition, and it does have to be certified by a physician. And the physician has to state, or I should say a healthcare provider, And they do have to state that that person is needed for the, for the health and well-being of the parent. And so there are some qualifications around using the family medical leave for caring for your parent. Not that it can't be. I did have one of the smaller companies tell me that elder care is more of an issue than child care because they have an older workforce. And so the elder care issue is harder for them than the child care. I had a couple of people tell me that just recently they'd either had, one company said they'd had 3 employees lose parents and they all took time through family medical leave to care for them prior to their parents passing. I was asking about it and they said, funny you should ask. Just this week I had 2 employees asking me about that. So calling in because they had to stay home and take care of their parents. So there are the issues out there, but what employers are saying is that employees at this point are still using it minimally as far as time away from the workplace, and they're simply using it at this point to take their parents to the doctor visits and things like that. They're not taking a leave of absence at this point in time. It may come to that, obviously, but at this point it's just a matter of doctor's appointments and short little jaunts right now. So, but the flexibility issue that was talked about earlier, I think, is probably one of the bigger things that employers would consider and will be considering with taking care, and it's no different than the child care issue. So they are aware of it, and the employers themselves are going to be dealing with these issues as much as their employees. So it will be spread amongst everybody.
Thank you very much. At the onset, I didn't give much commentary on each one of the presenters because I wanted you to hear them without me saying or sharing extra information. And you can see each one is an expert in their area of practice. And we so appreciate the outstanding information that you have shared. And I don't know about the audience, but I have lots of questions because when you have experts in your midst, you don't let them get away with all that good information without picking their brain even more. I can ask each one of them several great questions just to grow. Even though I'm in healthcare, we always learn. I would just like to ask Cheryl, you mentioned about having to have respite care and then having to have someone come into the home and so forth. Now, do you have to pay for this out of your pocket, or are there specific resources, or what do you do? And then I would like to go to Joy and ask her, if we forget our car keys, do we have onset of Alzheimer's? Okay. Are we getting there? Okay. And are there ways that we can prevent Alzheimer's? So speak to those, and if Ms. O'Connor's, and if you would speak to other resources, etc. I don't mean to ask all the questions, but like I said, I have lots of questions, and they're the experts, and so we want you to just share that information with us, and then I would encourage you to have your questions ready to ask them as they each try to address some of the questions that I've asked.
Yes, we are in a good position, I guess. My mother has, Social Security income and a small pension of her own and a small amount from my dad. And so far, that her monthly income has been enough to pay for all these things. And then we were paying the full amount for her side-by-side daycare, and now I think through Agency on Aging, we are getting financial help with that. And so we are paying a lot less right now. But I think, depending on how our situation changes, we're very fortunate because her monthly income is enough right now to cover daycare, respite care, somebody coming into the home, and the personal items that she needs, which I find that is increasing all the time too. It's not a big thing, but you're buying diapers that you didn't used to buy, and extra bedding, and I'm doing a lot of laundry, lots of laundry. She has a good medical coverage, a supplement, and we pay quite a bit for it, but again, there's enough of her money to pay for that, so she has prescription coverage and all that, so we're very, very fortunate.
So you've been losing your car keys. No, actually, that's pretty common. You know, if you drive your car to the mall though and forget that you have a car and can't remember where you know, it's not just forgetting where you parked it, it's forgetting that you have the car. That's probably something you want to get checked out. But there are some normal kinds of things that happen as people get older, and certainly things like losing your car keys and that sort of thing is pretty common. But when it starts getting into things that start interfering with your ability to function on a day-to-day basis, if you're forgetting appointments on a regular basis, if you're forgetting names of people that is not part of what your history is. I mean, if you always had difficulty remembering names and then all of a sudden started that's probably not going to be a difference. But if you start not recognizing people that you know, or names, or those kinds of things, where it's starting to have an impact on your day-to-day life, then it's something that you probably really want to get checked out. And we encourage folks to obviously start with your physician first. And for Alzheimer's disease, and for any other type of cognitive change or things that you might see, you know, make sure that your doctor knows that. Because a lot of times, one of the questions, I've been working in this field for about 30 years now, and one of the questions that people used to ask me, and still do, is if you knew that you had Alzheimer's disease, would you want to, or if you had Alzheimer's disease, would you want to know it? And a few years ago, people would say no, because you're not going to change the outcome anyway. And fortunately, the attitude about that is changing, because you do want to know, because there are more treatments out there. There's no cures at this point, but there are some medications that have really had some positive impacts on folks. And it's like any other kind of illness that you receive treatment for. The sooner and the earlier that you catch that disease process and you seek out treatment, the more successful the treatment's going to be. It's not going to stop it, but it can have some slowing of the symptoms, which allows you more time to have control over planning the remainder of things that you need to take care of, like how you're going to be taken care of, maybe some things with your family, etc. So it is something that you want to know. In terms of can you prevent it? No, but there are some things that you can do to help it. In fact, there's one of the things that we promote right now is called Maintain Your Brain, and there's a little bit of an information up there. And it really talks about some taking care of yourself. You know, you hear lots of things about taking care of your body. Well, your mind is part of your body. Sometimes we don't think that way, but it is. And so the healthier that you can keep the rest of your body, the healthier you're going to be able to keep your brain as well, in terms of cardiovascular kinds of things, and things of, for example, good dental hygiene, which may sound kind of odd, but that plaque that winds up on your teeth can kind of go through, is the same type of plaque that goes in your arteries. It can accumulate in the brain. It can do lots of things. So there's a direct connection between the healthiness of your body and eating healthy and how you cognitively function as well. So there's some information up here about that if you want a little bit more. But right now there are a lot of new things on the horizon that look very promising and hopeful for Alzheimer's disease.
Excellent.
The Area Agency on Aging administers federal, state, and local millage dollars for senior services. And Kent County is very lucky to have a millage. I think more than 60 counties in the state have a dedicated senior millage. Even with all those funds, there isn't enough money to address all needs. And so, though we don't have income eligibility requirements for the services, if the family is able to pay for part of the services and then utilize the governmental money as a supplement, you know, that's what we look for. Obviously, if we have a large need, we're targeting those who have no other resources, but we try to help everyone, even if it's a little bit, and we do ask donations or sharing part of the cost of the service, and any money collected goes right back into the service.
Great. Mandy, did you want to share any
commentary in addition to resources that may be applicable?
Well, actually, I was just going to make sure that I got everybody's name because one of the things that happened earlier this year, I was on the similar panel about the child care, and I took a whole lot of information from 4Cs, and the employers at the roundtables just gobbled it up. So I would say one of the things that we also need to do is get the information out to the employers, not just to the community, but to the employers, because they can throw it out in their lunchrooms and on their break rooms and put it, out on the picnic tables and whichever, and the employees are just, they're grabbing for it. So the more information we can get out there, the better off we're going to be. And I think that's just vital, and they're looking for it.
Thank you so much for answering my questions. And what are your questions? Go ahead, please.
I have been noticing as of late that probably at least half of the people I know who are dealing with care issues for elder members of their family have those members in another state, and they're trying to deal with issues across state lines. Any comment at all about that?
That is common. There is a national number called the Elder Care Locator, and I think it may even be in your packet, because obviously you need to find out what agencies are in the area of where your relative lives, and if you call the national number, they will direct you there, and then you can deal with those agencies. But there are similar programs across the country, across the state, but there are some differences.
The Alzheimer's Association has a program too called Care Finder that's online, and it's just carefinder.org, and it can go into different states, and there's some assessment kinds of things to help you identify what specifically your needs might be and narrow it down a little bit, and it has some resources there too.
Not only across state lines, but one of the responses that I had from the employer was that a lot of the employees in this, as the world gets smaller and smaller, had parents in other countries. Mm-hmm. So then how do you get leave time, family medical leave, and you're dealing with medical practitioners in another country that have to fill out our family medical leave forms in order for it to be approved. And it's, and I'm sure that's going to be happening more and more also, because, as I say, the world keeps getting smaller, and with some of the highly technical jobs, and not even just the technical jobs, but we're seeing more and more of an influx of people coming in from other countries, and they have to take care of their parents and their families.
One of the things that is starting to be more and more up to are care managers, that basically what they do is similar to what you're talking about, is if there's long distance folks involved in caring, is that someone on the end of the older adult there's a local person that will kind of help coordinate some of those services. Now that's for a fee, and often those are privately done, often with a social worker or a nurse or whatever, but that's part of what they do, is help coordinate services and care for long distance kinds of things. So that would be, again, check with some of the numbers or the on the internet for different resources nearby. And most communities will have like an area agency on aging or an Alzheimer's disease organization or something like that. And a lot of them will have smart numbers, which means, for example, on our 800 number here, wherever in the United States that number is dialed, it will automatically take you to the local association. And there are a lot of organizations now that have those. So it's probably important, for example, I get calls frequently of someone that calls me here, but hoping to get someone in another part of the state. And so what we can do then is direct them to that number, or give them that direct line to that office. So there's a network out there. You kind of have to figure out the key to it, but more and more organizations are doing that.
Excellent. Are there any other questions? Yes.
You mentioned that called
Safe Return.
Can you, where would you call about that?
You can call our office. You can also go on alz.org, and that's our national website. So in there you can go, it'll click on any state. There's like a little map in there, and then you can kind of navigate in there. But it also has information about our Safe Return. But you can call our office, and we can send you the information as well. And there's a registration fee of $40, and that includes the jewelry that comes with it. The other thing that we really encourage families, if you are a caregiver, is make sure that either on your body or in your home somewhere that you identify yourself as a caregiver, because if there's any kind of an emergency that you're involved as a caregiver and somebody, the EMTs or something, come and take you, they may not know that the person that you're taking care of is not really able to be left alone. So we always encourage the caregivers to make sure that they have information identifying themselves as a caregiver and who to contact in case of an emergency on their behalf.
Excellent. We have time for just one more question. If someone has a burning question that they do not want to leave this room without asking, now is your time. Go ahead, please.
How do any of you relate to the AARP?
We just have a working relationship with AARP. That's,
Consisting of what?
pardon me?
Consisting of what? What's the working relationship?
Advocating for senior issues is one thing. In Michigan, AARP has been involved with a committee concerning long-term care, single point of entry. So we have been involved with committee meetings with them there.
Okay, excellent. This brings our Fourth Friday Forum to a close. And I would like to remind you to complete your evaluation forms. And I would like to have Christy share with us just a word or two regarding the next forum, because we will be holding these forums continuously, although we will have some time off during the summer. So Christy, will you tell us a little bit about our next forum?
Our next forum will be